Wait, don't scroll. If sodium has ever confused you, this is the video that will fix it permanently, because I promise you, most nursing students don't fail sodium questions because they don't know it. They fail because they overthink it, and NCLEX loves that mistake. So in the next few minutes, I'm going to break this down so simply, you will never get a sodium question wrong again. Here's what usually happens. You see a sodium question, your brain starts racing. Is it fluid? Is it electrolytes? What do I do first? And before you know it, you pick the wrong answer. But what if I told you sodium is actually one of the easiest topics if you understand one concept? Sodium controls water movement, that's it. So every time you see sodium, ask one question: where is the water going? If you answer that, you answer the entire question. If sodium is low, the blood becomes diluted, water moves into the cells, especially brain cells. Now think about that. What happens when the brain swells? Increased pressure, decreased function, life-threatening complications. Signs you'll see: confusion, headache, nausea, seizures, and decreased consciousness. Now here's the NCLEX priority: protect the brain. That means monitor neurostatus, seizure precautions, and prevent injury. Because brain swelling equals an emergency. If sodium is high, the blood becomes concentrated, water moves out of the cells. Now the cells shrink, especially brain cells, which leads to confusion, restlessness, and weakness. Now think, a dry brain is not a safe brain. It leads to dysfunction and damage. NCLEX priority: rehydrate, monitor neurological status, correct slowly, never fix sodium too fast. Use this and you'll never forget. Low sodium equals swollen brain. High sodium equals dry brain. That's your entire shortcut. Let's test your thinking. Patient sodium is 118. What is your priority? A. Encourage fluids. B. Monitor neurological status. C. Restrict sodium. D. Document. Pause. Don't rush. Think. Correct answer: B. Monitor neurological status, because low sodium equals brain swelling. Brain is the priority. Now try this. Patient sodium is 158. What's your first action? A. Restrict fluids. B. Encourage hydration. C. Monitor heart. D. Ignore. What's your answer? Correct answer: B. Encourage hydration, because high sodium equals dehydration. You must replace fluid. Watch this carefully. Patient with low sodium starts seizing. What do you do first? A. Check labs. B. Protect airway. C. Call provider. D. Document. This is where people get tricked. Correct answer: B. Protect airway, because ABCs always come first. Airway over everything. Do you see the pattern now? Sodium is not about memorizing numbers. It's about understanding what's happening in the body and choosing the safest action. For my international nursing students, this is where the difference is. Many systems focus on definitions and theory, but NCLEX focuses on what will you do as a nurse? What is your priority? What comes first? Remember this forever. Low sodium equals swelling equals brain danger. High sodium equals dehydration equals cell damage. And always prioritize safety. Be honest, was sodium confusing before this, or does it finally make sense now? Comment below. If you want more breakdowns like this, especially for international nursing students, you need the right guidance. Pass your next exam using RN and LVN Refresher online help from Gab-Nic Excelsior Nursing Tutoring Center. Go to my profile, tap the link in my bio, and choose your course. Inside you'll get lab mastery, case-based questions, and step-by-step NCLEX strategies. And don't forget, check my description on YouTube for full lessons.
Profile. Once you're in, select the RN Refresher course. You'll also find a weekly timetable to help you study consistently and stay on track, so you don't feel overwhelmed while studying. Revisit important topics. It's not just about studying harder. So if you're ready to improve your understanding and stay consistent,